Hi, my name is Debbie. I'm the SMI Serious Mental Illness Annual Health Check Champion. The purpose of this video is to improve communication during the SMI Annual Health Check and to enhance the patient's experience and outcomes. So, communication tips for health professionals, why it matters. The main thing is that people with serious mental illness face a lot of barriers to care. Effective communication helps to bridge that gap. So here we have something called Morabian's rule. And as you can see, the words that you use are only a small part of communication, making up 7% of the communication. Body language is the biggest element of communication and an area that we can have most impact in communicating effectively. 38% is with the tone of voice. So being aware of all aspects of communication is important, but particularly aware of your facial expressions, eye contact, body posture, gestures, and how those gestures and body language may be perceived. So here are some top tips. Building a rapport and a relationship. Using the person's name. Greeting them warmly. Asking open-ended questions like, what's important to you today? So it's typically those what, where, why, and how type of questions, because it's more likely to elicit a fuller response from the person. Active listening is about being present, being focused on what that person is saying, listening to them so that you're not just thinking about what you're going to say next. It's really listening to the person, reflecting back what they say, avoiding interrupting. If they've got any concerns or they're experiencing any emotions, it's about validating their concerns. Empathizing. You might want to say things like, it sounds like you're experiencing a really difficult time at the moment. You sound very frustrated by that experience. Breaking down explanations, using simple language, avoiding jargon. And if you need to use visual aids or write things down, that's always a good idea too. Because sometimes in appointments, there's a lot of information that's been imparted and it's quite easy to forget or misinterpret things. So if it's written down, or that person may want to record it on the phone if that works better. It's about being flexible to that person's needs. So adapting to individual needs. Under the Equality Act of 2010, healthcare providers must make reasonable adjustments for individuals with disabilities, and this means people with serious mental illness. Reasonable adjustments are really just small changes that can be made to ensure that services are more accessible. Because what we want to do is to reduce health inequalities. We want things to be fairer. It does mean that that person may need longer appointments. It might take them longer to explain things. It might take them longer to understand what's being said. They might need easy read documents, a quiet space to wait before the appointment because they might experience anxiety. An interpreter could be needed if that person's first language is not English. Bringing a carer is something that is definitely encouraged, and that patient might not know that they can ask for these things. So it's about identifying if they have any additional further needs. You might even need to consider a home visit in some cases. Always send out a reasonable adjustment leaflet so that you can adapt the appointment to their individual needs. Sometimes you might have somebody who's got a serious mental illness, and a learning disability. So again, it's adapting whatever methods of communication to help that person to feel more comfortable and to get the best out of their appointment. So this is a screenshot of System 1, and it's how to record reasonable adjustments. So recording any reasonable adjustments or communication needs on System 1 will mean that any colleagues are aware that anything that needs to be put in place prior to an appointment is there. It also means that the patient doesn't have to keep repeating themselves each time. And it's all documented on the records, and it will come up on the homepage for that patient. On the next 3 slides, we've got how to record reasonable adjustments on EMIS. If this doesn't apply for you, you can just skip ahead to the next slides. It's good to be prepared before the appointment or the call. Look at recent consultations. Who've they seen? What was the outcome? What was the experience? Prepare for any potential barriers. And if you can, before the appointment, send a text reminder, or it could be a phone call, or it could be a letter, depending on that person's needs. Generally, we send out a patient pack that details all the information that's going to be covered in the SMI annual health check. But it's always a good idea to follow that up with a reminder. If there are any potential barriers, then it could be transport issues, it could be anxiety issues. It's about exploring those barriers together, offering some solutions, working out a plan, doing things one step at a time, and just to make sure that all the reasonable adjustments that needs to be made are made for that person. During the appointment, make every contact count. Making sure that you've got all the correct details for them, correct telephone number, address, family contact details. It's always good to find out, have they got a carer or are they a carer for somebody else? It is really important that you do ensure that you've got their consent to record this information if you are putting down a family member, and asking if they can be contacted if you're unable to get hold of them. And at each appointment, no matter what that appointment is, check for any missing care processes, because what sometimes happens is that that person may come for other checks. It might be an asthma review, it could be a long-term conditions review, and they might not be asked about certain things. One of the things that we do find that is quite common that they're not asked about is alcohol. So it's important to do the alcohol screening and also to check what is their smoking status. As part of the SMI annual health check, then there are those 6 core elements: checking the BMI, the smoking status, the alcohol, as I've previously mentioned, but that sometimes gets missed on other health checks, blood pressure, lipids, and blood sugar. An enhanced check may include a medication review, questions around substance abuse, lifestyle, things like physical activity. If that person is very inactive, do they want support to become more active? It's about ensuring that the health action plan is completed and a printed copy given to the patient, and any onward referrals to social prescribing or advice on cancer screening or very brief advice on smoking cessation. So it's making sure that every contact counts. So some final thoughts. Being empathetic is important and enhances that therapeutic relationship. ensuring a really good quality SMI annual health check. What we want to do is to increase the uptake of the SMI annual health check. So, as I said earlier, a text reminder or a reminder in whatever communication method the patient prefers needs to be sent. When a carer has been identified, that reminder can be sent to the carer. And it's about making every contact count. If you or your practice does need any further support, I do awareness sessions. It's particularly helpful with new staff. We can tailor it to suit your needs. It can be around the invitation process, could be about improving engagement or signposting to supported services, or whatever it is. Speak to me about it and we can tailor something to suit your particular practice. So what are the take-home messages? What can you take away from this video session? Do you think you'd like any further training? If so, you can get in touch with me and I can come to your practice or we can do something on Microsoft Teams. Do you need any additional resources? There are some training courses that you might find valuable. One of them is an in-person course and it's on making every contact count. And you can book a place. There is an email address there. It's nickyburn@cht.nhs.uk. There's also e-learning for health, and there's something on making every contact count. That's e-learning for healthcare. And then there's a fact sheet, which there's a link on this slide from Health Education England. Hope you've enjoyed the session, and I hope to speak to you soon.